Dear students, welcome back. In this session, we are going to discuss about anal canal. The anal canal is the terminal part of the alimentary canal. It starts at the anorectal junction. So it starts at the anorectal junction at the level of levator ani and ends at the anal opening in the perineum. It ends in the anal opening in the perineum. It is directed downwards and backwards. It is directed downwards and backwards. If you see the length is 3.75 centimeters and the diameter is 1.25 to 1.9 centimeters. Okay. This is about the general information. And this anal canal, except during defecation, the anal canal is collapsed by the internal anal sphincter and external anal sphincters. The anal sphincters is surrounded by, the anal canal is surrounded by the internal and external anal sphincters, which plays a crucial role in the maintenance of fecal continence. Okay, if you see the internal anal sphincter which surrounds the upper 2/3 of the anal canal, so it surrounds the upper 2/3 of the anal canal. It is formed from a thickening of involuntary circular smooth muscle. So it is formed by involuntary circular smooth muscle. If you see the external anal sphincter, which is a voluntary muscle, this one is a voluntary muscle that surrounds lower 2/3 of the anal canal, and it also overlaps the internal sphincter. Why? Because upper 2/3 and lower 2/3 means there may be some overlapping of these two sphincters. Okay, it blends superiorly with the puborectalis muscle of the pelvic floor. So puborectalis muscle, actually it is placed here, which this external sphincter is blended with this puborectalis muscle. Here you can see the puborectalis muscle, so which is attached from the pubic symphysis around the anal canal. So this is blending with the external anal sphincter. Okay. And this puborectalis muscle is the one of the muscle of pelvic floor. At the junction of rectum and anal canal, there is a muscular ring known as anorectal ring. It is formed by the fusion of internal anal sphincter, external anal sphincter, as well as puborectalis muscle. Okay, on palpation, on digital rectal palpation, this can be palpable during examination. Okay, now we will move on to the internal structure of the anal canal. Yes, the superior aspect of the anal canal has some epithelial lining called as columnar epithelium, can be seen in the superior aspect. However, in the anal canal, the mucosa is organized into longitudinal folds known as anal columns. These are anal columns are present, and these are joined at the inferior ends by anal walls. So at the anal walls. Next thing is, above the anal walls or some small pouches which are referred to as anal sinuses. So here you can find the pouches called as anal sinuses. These contain glands that secrete mucus. The anal walls collectively form an irregular circle known as pectinate line. So this is called pectinate line. This one is also called as dentate line. This line divides the anal canal into upper and lower parts, which differ in both structure as well as neurovascular supply. Okay. Yes. So this is about the internal structure. If you see some of the anatomical relations, normally in the male, perineal body is anteriorly related, urethra and bulb of penis. Whereas in the female, anteriorly it is related to urogenital diaphragm and vagina, anterior relations. Posteriorly it is related to the anococcygeal ligament, coccyx and sacrum on the posterior aspect, And laterally it is related to ischio-anal fossa. So these are some of the relations. Now we will move on to the blood supply. So if you see the blood supply, arterial supply, so some of the blood supply is same as that of the rectum. So here above the pectinate line, this one is supplied by the superior rectal artery, which is the branch of inferior. So here you can inferior mesenteric artery. This is coming and supplying at this part. Okay. And next one is below the pectinate line. It is supplied by the inferior rectal artery. Okay. If you see the venous drainage, so here we can find the pectinate line, isn't it? Above the pectinate line, it is drained by the inferior mesenteric veins, that is superior rectal veins. Superior rectal veins drain the part which is present above the pectinate line, and below the pectinate line it is by the inferior rectal veins. Okay. And if you see the nerve supply, so above this pectinate line it is supplied by the hypogastric flexus, and these are sensitive to stretch. Okay. Whereas below the pectinate line, it is supplied by inferior rectal nerves, mainly the branches of pudendal nerve, which are sensitive to pain, temperature, touch and pressure. Now we'll move on to the lymphatic drainage. So the lymphatic drainage above the pectinate line, it is drained by the internal iliac nodes. It is drained by the internal iliac nodes, and below the pectinate line it is drained by the superficial inguinal lymph nodes. This is all about the anal canal. Thank you.